Hi, I'm Dr. Roslyn Kellum, better known as Dr. Roz, and I'm the dental director for the Mission of Mercy Mobile Dental Clinic. And this is Errol Kellum,
Hi.
and he's the dental coordinator. The majority of our patients delay treatment because they just don't have the money or they fear coming to the dentist. So when they discover our services, many experience surprisingly freedom of pain and infection. Their fears often turn into joy, laughter, fun, and gratitude once they leave the dental clinic. Often our patients comment saying that we are their heroes or their lifesavers. Now I would like to invite you to take a tour on our mobile dental unit. So come on aboard. As we enter the dental unit, this is our registration area and our patient waiting area, where patients' blood pressures and their pulse ox are monitored, recorded, and if we detect any abnormalities, they are referred to the medical team. To your right is operatory 1 and 2, where patients are treated in our state-of-the-art operatory chairs. Also, we have a sink for hand washing and multiple cabinets for storage. As we enter the mid part of the clinic, this is our sterilization area. Our sterilization area is divided into two areas, the dirty side and the clean side. To your right is the dirty side, where we have an ultrasonic, which is the first process of the sterilization of our instruments, where they are debrided and cleaned. Then we have a sink, and then we have a machine that cleanses and lubricates our hand pieces. And we also have additional cabinets. To our left, we have an area for our sterilization where our autoclave is. Underneath here, we have a amalgam separator where it won't contaminate the environment. Also, we have our sharp instruments and our red bags down here. This operatory right here is used for multi-purposes. It is used to treat patients. It has a sink for hand washing. We have multiple cabinets, and it's Dr. Roz's office, my office, and we also do teledentistry evaluations back in this office. As a result of COVID-19 and the challenges of treating patients, we have utilized teledentistry to reach out to patients who have nowhere to go and to reconnect with our existing patients. In teledentistry, patients are screened for COVID-19. Medical and dental histories and medications are reviewed. Dental problems and emergencies are managed. Prescriptions are prescribed, and patients are then scheduled for appointments.
We use the state-of-the-art, which is called a Nomad. It's a handheld operation where we can go from operatory to operatory to take the x-ray of the patient, shown up on the screen after the x-rays are taken. This is SCA Jade air purifier that cleans the air 6 times an hour. It removes 99.998% of particles down to 0.01 microns.
We have central air conditioning. We have thermostats in each operatory for temperature control. We have bilateral sliders for extra space, and the van also has a basement for extra storage. Thank you, and we hope you enjoyed it.
Hi, my name is Maureen Little, and I'm the Nursing Director for Mission of Mercy, Maryland, Pennsylvania. Many of you may be familiar with Mission of Mercy already and how we operate our clinics, but as in all healthcare practices, we've had to change due to the response of COVID-19. Previously, our patients would arrive and enter the building where we are setting up and wait in a waiting room, check in at the registration desk, and maybe even enjoy a cup of coffee. But now our patients arrive in the parking lot, and one of our registration volunteers goes to the car window, checks them in, takes their temperature, and asks them a series of COVID-related questions. After that, the patient is called in one by one into the building to see one of 2 or 3 triage nurses who will take their vital signs, weigh them, review their medications and allergies, and maybe discuss any new problems that they might be having to get them ready to see one of the practitioners. At that point, they go to see the doctor if one is ready, but if not, go back to their cars to wait again until called in to see one of the practitioners. Now we're inside the medical van, and our volunteer driver is now busy at work during the day, answering telephone calls, managing patient flow by means of a walkie-talkie, running errands back and forth inside the building, and most importantly, entering data into the computer at the completion of every patient visit. My role on the medical van, along with another nurse volunteer, is to manage the pharmacy, dispensing medications to our patients for chronic health conditions such as diabetes, high cholesterol, and hypertension. The van nurses also assist the practitioners doing steroid injections and possibly nebulizer treatments and EKGs if indicated.
There's been a lot of changes in how we do things since the COVID situation arose. It used to be, when we started, this was a waiting area where we would keep 2 or 3 of the next patients waiting to be seen. This would be one practitioner's area to my right, the curtains closed around it for privacy. As we walk back into the middle, we see this is my area. This is probably the largest of the exam areas. And then pre-COVID, we actually had another complete exam room back behind this curtain. Right now, we use it as a storage area for all of our PPE equipment. But with COVID, we can only really have one practitioner on the van and maintain social distancing. So that has meant that we've had to take 2 of our practitioners and set them up inside in cubicles inside so that we could have 3 physicians. But we're used to having sometimes 4 or 5. And so without that, and with the obstacles that have been imposed by the COVID situation, it's certainly cut down on the volume of face-to-face visits that we can have. So now we're looking at sort of dividing the patients we serve in their appointments with a combination of telephone calls and face-to-face so that we can still maintain that volume of 50 to 60 patients per visit or per clinic, because we really need that to serve the people that are already our patients. Now, most of what we take care of is chronic disease, but we are equipped to take care of certainly some emergencies. I just said a few things out here. We do have oxygen therapy. We could stabilize somebody starting an IV, waiting for an ambulance. We have the defibrillator, monitors, equipment. So hopefully we don't have to use those kind of things very often, but we are equipped to take that, because when you're parked out on the street and anybody can walk up to the van, you never can tell what's going to walk up to the van. As far as the medications is a big part of what we do, because we realized when we started 27 years ago that it really doesn't do a lot for someone's dignity if you tell them what's wrong with them and hand them a fistful of prescriptions that they could never afford. And so we have tried to be able to provide all of their medicines, or at least a fair amount of them, at a very low cost over the years. And in order to do that, we can't really go out and purchase all of these things. So we are tied into a couple large nonprofits, AmeriCares and Direct Relief, who provide us in quantity a large amount of free generic medications for pretty much all sorts of problems. So between that, and then also for high cost medications that there's no substitute for, the drug companies usually do have programs where we can get patients give medicine 3 or 4 months at a time for a given patient, and then those can be renewed every 3 or 4 months up to a year. So we're even able to get some of those high cost medications for some of the less common and more serious problems. And then lastly, what's been a big help is when the various drugstores have come up with these lists with $4 prescriptions or $10 prescriptions, or these discount cards. So between that whole combination of things, we're still able, 27 years into this, to make the medication's either free or very affordable for most of our patients. There are a tremendous amount of patients that are patients in pain, patients with orthopedic problems, patients with previous trauma. And these are patients that, in a perfect world, they would be seeing pain management. Many of them have seen pain management before, but when they lost their insurance, they lost any ability for pain management or to see the specialists in pain management. And so many of the primary care doctors anymore, in view of the controlled drug, crisis in the country, they will not prescribe them at all. And so we have a patient population of people out there who have documented need for pain management and no one to fill that void. And so we have also tried in selected cases to help fill that void. And to do that in a responsible way, we have the ability on van to check in with the computer systems through the state to make sure they're not buying anything else anywhere, and also to do urine drug testing, 12-panel urine drug testing right here on the van. So in doing those things, we're trying to provide a service to a very needy population who has sort of been abandoned, and do it in a way though that's still safe and responsible for them and us. And finally, I'd like to thank all of you for your support in us, for your interest in us. And I think most importantly, the plea that we would put out, in addition to obviously the financial help we always need, is for your prayers, since this is a mission that is totally founded on prayer, and we only see the miracles not because of the medical things that we provide, but because of the things that God provides through the prayers that we offer Him. Thank you, and God bless you.